Here's an AMI This Week shortcut with Alex Smythe.
Vision loss is a global problem, and in remote and developing regions of the world, it can be hard to access care. One organization has been working tirelessly to change that. Dr. Hunter Cherwick is the VP of Clinical Services with Orbis, and he tells me more.
Orbis is a nonprofit organization that is solely focused in treating and preventing blindness around the world. We have many pieces of our program portfolio. We're most famous for our Flying Eye Hospital. It is an MD-10 aircraft that we have converted into a classroom, a simulation center, and a state-of-the-art eye care facility. It's doing everything. It's teaching doctors, nurses, anesthesiologists, as well as ophthalmologists. It can do lasers. It can do any procedure that you would be able to do in Toronto, anywhere in the world. When we land, the only thing we ask of our partners are for stares, patients who need our help, and eye care professionals who want to learn and exchange skills.
And so all these tools, what is the end goal for Orbis through these programs?
Our goal is we see a world where no one unnecessarily suffers from visual impairment or blindness. 90% of visual impairment is in the developing world, and 75% of that could be prevented or treated. There's definitely vulnerable populations, for example, women, children, the elderly, and most recently, refugees or displaced persons. So we are really focused on getting the help to those who need it most. And the model that we work in is not just service delivery, providing care, not just skills transfers and training, but also systems transfers, helping hospital managements. We've been doing webinars on how hospital leaders can address and safely do patient care during the COVID crisis. So really our goal is to provide all aspects of care and support that will be needed to help those who need it most.
And there are a number of other programs that Orbis operates as well as the iPlane. So can you tell me a bit about those and how they've been adapted due to the current COVID outbreak?
Yes, I mean, obviously COVID has changed the world and definitely we've had to adjust our programs. One of the most exciting things has been our telemedicine distance learning platform, CyberSight. The director of CyberSight is actually Canadian. And what has been amazing, we've had a 300% growth where we've had to increase our Zoom license twice over the span of 2 months because so many people want to attend. We recently had a webinar, a live interactive webinar, where 102 countries were actively participating during the session. So with CyberSight, we are able to do e-consultations. We've managed over 30,000 patient consults.
Wow, that's truly impressive. And it really shows the impact and the importance of your programs. So I'm curious, with all this uncertainty surrounding COVID right now, when do you expect or maybe hope that the iPlane will be back up, running, and servicing the various areas around the world again?
I think it really depends on which countries we're starting and what are their local requirements. The good news is a lot of our work is in Asia and Africa, and they're coming out of the pandemic relatively quickly. So this is something that we're working on and following on a weekly basis. I would say, again, what's been miraculous is our CyberSight, where we're now doing live teaching, where the same professor through the internet can be in the operating room virtually, coaching the doctors, going through the surgery, going through lectures, things like that. So for me, the plane was started to connect the world and expose people to the latest and greatest technology and teachers. And we're now doing the same with the internet and our CyberSight platform.
With the ability to connect to remote regions of the world, Dr. Cherwick sees a bright future for Orbis, but also highlights the real impact the organization can have on its clients.
Obviously, I think we always want to build on our strengths with the Flying Eye Hospital, the clinical training, and CyberSight. I think we're just now beginning to see the power of artificial intelligence. We've also started simulation projects where, just like you train a pilot, we're going to be training a surgeon where they'll do the task or the surgery 1,000 times before they ever step foot in an operating room, and making those simulation devices affordable, durable, and something that will bring real value to low to middle income countries is extremely exciting. It's just a miracle. Every day we have people come on the aircraft who cannot see, and the next day they're seeing, well enough to drive a car. And that doesn't get old.
Well, this is such an incredible service and organization. How can people donate and support it?
Yes, I think obviously we're appreciative of everyone who's interested in our mission. You can go to our website, www.orbis.org, and learn about the great work we do, our team, our mission, how we achieve that mission through technology and training. So I really encourage people to go to orbis.org. For those who are tech fans and want to learn more about what we're doing with distance learning and telemedicine, you can go to Cybersight, cybersight.org, and see what we're doing, see how we're helping people, especially during the COVID crisis.
That's perfect. Dr. Czurek, thank you so much for chatting with me today.
Thank you so much for this opportunity. I hope you all have a great day.